Namaste and welcome to another episode of Neuronotes. I am Yashoda Gupta, a final year medical student studying at Patan Academy of Health Sciences. Today, we will explore an important neurological condition through a real clinical encounter and discuss what everyone should know about recognizing it and responding properly.
Namaste, I am Dipesh Kisoroka, a third year student from PAS.
Namaste, my name is Deepa Acharya. I am a third year MBBS student from PAS. To begin, let me share a case that I have encountered during my clinical posting. It was a case of a 22-year-old male college student who was presented with a 6-month history of 3 episodes of loss of consciousness. According to his friends, each episode started with him staring blankly for a few seconds, followed by rhythmic jerking of all 4 limbs for approximately about 1 to 2 minutes. During one event, he sustained lateral tongue bite and urinary incontinence. After each event, he remained drowsy and confused for about 20 to 30 minutes before coming back to being normal. So, what do these symptoms make you think of?
Perhaps all these signs you have mentioned are pointing toward one important possibility, that is a seizure. Normally, our brain communicates through millions of nerve cells with tiny electrical signals. So, a seizure occurs when there is sudden, excessive, abnormal burst of electrical activity in the brain. So, the abnormal activity temporarily disrupts the brain normal functioning, leading to these symptoms. But are all seizures caused by the same cause?
Well, there isn't just one cause for seizures. They can occur for many reasons. They may be triggered by high fever in young children, head injuries, brain infections such as meningitis and encephalitis, stroke, tumors of the brain, low blood sugar, electrolyte imbalances, toxins, and alcohol or drug withdrawal, or even some medications. Some people have seizures because of a condition called as epilepsy. In this condition, there is a lasting tendency to produce recurrent, unprovoked seizures.
That's interesting, but do seizures always look like the dramatic shaking most people imagine?
Not always. Well, many people associate seizures with dramatic shaking of the body. Some may experience subtle or atypical presentations. A person may suddenly stare blankly for a few seconds, or become briefly confused or unresponsive, make repetitive movements such as lip smacking, or experience unusual sensations of strange smell, or have sudden involuntary jerking movement of a single limb. While these symptoms are often mild and mistaken for stress, dizziness, and daydreaming, many seizures go unrecognized. And this is not the only challenge people with seizures face.
I completely agree. Beyond the medical condition itself, seizures often carry a significant social stigma. Many people with epilepsy face misconceptions, discrimination, and unnecessary fear because of a lack of awareness.
So, if we ever witness people having seizures, what should we actually do?
That is an important question, Deepa. The good news is anyone can help just by remembering 4 words. Stop, turn, stay, call. Stop, stay calm and protect from danger. Turn onto one side till the seizure ends. Stay until the person is fully awake. Call emergency services if seizure lasts for more than 5 minutes or repeats without recovery.
Well, we have just talked about what to do during a seizure, but just as importantly, could you tell us what should we never do during a seizure?
Well, absolutely. A simple way to remember is the mnemonic DON'T, D-O-N-T. D is for don't restrain the person or try to stop the jerking movements. O is for do not put objects or even our hand in the mouth. N as to don't give nutrition, that means no food, no drinks, no medicines via orally. And T for don't try to wake the person up or move them unnecessarily.
Today's case reminds us that seizures do not always present as dramatic convulsions. They can also be present with subtle symptoms which are easily overlooked. Hence, recognizing these early warning signs, seeking for timely medical help, and practicing appropriate first aid can make a huge difference to a person's safety and recovery.
Thank you for joining us on Neuronotes. A special thanks to Mission Brain Pass for providing us this platform. Until next time, keep learning, keep spreading awareness, And remember that right knowledge can save lives. Take care and namaste.